Good afternoon, madam, and very warm welcome to St. Medical College and KM Hospital. And it's really a pleasure indeed to have you with us. And we will like to listen to your story, your journey, uh, professional journey, personal journey, and your journey as a writer, as an author, and a people's person, most of all. So, madam, I will request you to start with how you can.
Good afternoon.
Good afternoon.
Welcome to KM Hospital. I am deeply touched and honored sitting here with all of these eminent personalities and getting an opportunity to listen to the entire journey of your life. It's going to be my collection from my lifetime, and special thanks for coming up to the ward and inaugurating the modular. Thank you very much.
Well, I don't know, I'm really overwhelmed to come back here and to see the institution has grown so well, and it has really touched my heart. And a chord in the heart, when it is touched, it creates music. So this is what I learnt in KM, apart from pediatric surgery. And of course, I'm an MBBS student from KM. I did my MS from KM. And then I did MCH also from KM. So all the three things, I owe my things to KM. So actually, nobody knows, I was born in these premises because my father was a AMO here, and I was born in casualty officers' quarters. These are now AMO's quarters and lecturers' quarters. There were plenty of trees, fragrant trees, and we used to enjoy it. Till about 5 or 6 years of age, I was in KM. Then my father shifted to SAN Hospital, so I shifted to SAN Hospital automatically. And from there, I used to come to KM. And what I remember was at King Circle, because I was in SAN, at King Circle, there was knee-deep water every time. And we used to wade through the water, but there was no leptospirosis, there were no problems, the water was clean. And the change that has now taken place is that when you wade through the water, you have to be very careful. So our life was much, much better, that's what I feel, than what it is now. Now are the days of technological advances. We are advanced technologically. But at the same time, our physical activity has become much less. And that is why when I had a fracture of the shoulder, right shoulder, the orthopedic surgeon who was my colleague told me that what you do is you should take the, what is it called in Marathi, zato. Put that pressure on the wheel and then go on moving your shoulder. You don't need any other physiotherapy. I was so happy listening to that. And I did it because I had that jata at home from my mother's side. And I have still preserved it. Those things which were being done by females, or so many times males also, are going to be very, very useful. In these days of mixers and various gadgets, there is no exercise, and that is why we need to go to the gym. So these are some of the things which have really I felt that I must talk in this forum, so that the younger generation knows that for a shoulder, fracture of the shoulder, you can have these grinding, and that grinding is very, very important. I then joined the King George High School, but it was called IES Girls School, Indian Education Society Girls School. There was no co-education. We were separated out and the others were separated out. But we had a common ground. If you go to IES, you will see a big ground. On one side is the boys' school, on another side is the girls' school. I was in the girls' school, but our principal was a male. So we used to really feel that for a girls' school there should be a female principal. And we all felt that, and we one day went to him and told him that, sir, you are very nice, but we want a female principal. She will understand our problems and difficulties. So I personally feel that a female understands a female much better. I mean, I'm not going to narrate a story, I'm also going to put my thought processes in between. At the same time, whenever a female appreciates another female, it is from the bottom of the heart. Because when she appreciates another female, she always adds but. Oh, she is very good. She is now Rujuta, but I know her by her first name, so Viju. When I call her Viju, I say, Viju, very good, but this dress doesn't suit you. This should never happen. A female must understand, if you appreciate from the bottom of the heart. Otherwise, don't appreciate, don't talk at all. So, this is something which is, I talked about music. Because here in KEM, there was a music in the trees. There was a music in everywhere. The wind that came also had music. The birds that chirped also had music. And that is why I developed a keen sense of listening to the music. I never was singing, but I did instrumental sangeet. And that was, the thing was called Dilruba. Probably nobody knows this particular string instrument. Everybody knows sitar, everybody knows harmonium, everybody knows violin, but Dilruba is not known. And that was my father's gift to me. When I passed my SSC, he gave me that Dilruba and he said, whenever you are depressed, work on this and you will feel better. And really speaking, I felt better. Of course, I have lost that now. That's why when I get depressed, I listen to that Dilruba, which is being played by my father. But at the same time, I must also narrate that when the teacher used to come on a Sunday to teach me Dilruba, I felt Sunday must never come. Because I never wanted to sit there for hours together, because he came on a Sunday because he could then go on for 2-3 hours. But that paid me rich dividends in the later life. Same is the story of my grandfather. My grandfather was very well versed in Sanskrit. And he used to tell me, Lata, you must go to the Sanskrit classes and also go for the exams, appear for the exams. Then I felt very sad when he told me that in addition to that I must learn Sanskrit. But in later life, whenever people listen to my speeches, they always say that, oh, your Sanskrit is very good. Nobody says my Hindi is good, because I never learned Hindi. But Sanskrit, they praise. And he used to tell me that what you say in Sanskrit, the pronunciation is so important that pronunciation makes you talk to each other and the communication skills improve. I don't know whether my communication skills improved, but I learned Sanskrit, and then he told me that in 4 sentences you can give so much of things. I'll just narrate one of those things of Lord Shiva. And he says, Asitagiri samasyat kanjalam sindhu patre suravara tarushakha lekhani patrabhuvi likhati adi gruhitva sharada sarvakale tadapi tavagunanam isha paramyanati. What does it mean? This fits in beautifully for KEM Hospital and St. G.S.MEDICAL College, because it says that if I have to appreciate you, And if I say that the whole earth is a paper, and if the mountains, I destroy those mountains and make a nice thing to do, and if I fell the trees and make a lekhani out of it, still all this will be insufficient to make you feel that what you are. And this is what KM is. What I am today is because of St. G.S.Medical College and KM, as far as the medicine is concerned. As far as the others are concerned, it is my school, that is the IES school, so I owe that. But most important is my mother. She is the first guru, very, very pleasant woman, very nice person. I wish I could be like her. I couldn't be like her, but she was very, very close to my heart. One thing I'll tell you, I was never a good student, a very ordinary student. One day when I came home, she asked me, why is your face so small? So I said, I stood 15th in my class. So she said, so what? What does it matter? How many students are there in your class? So I said 35 students. In those days there were never 60 students, 35 students. So she said, look at that 35th number and you will feel better. Then the next time my number was 10th. So she said, you must be feeling very happy. But I must tell you, now you look at the first number and see that you can achieve that. This is what she imbibed in me, that never get frustrated and also look at the top and always achieve the top. My height is short, so I used to come home crying, saying that, telling my mother, why is it that I don't have a height like Lupa Mehta or Satish Paralkar? When I did that, she said, what is wrong with you? Why are you crying? So I told her, I'm not crying, but I'm telling you that why is my height not as good? So she said, what troubles you? I said, the teacher tells me to sit on the front bench and asks me questions. So she said, what's wrong? The best thing to happen is that you study so much that you will be able to answer all the questions. The height will never bother you. See how the mother makes use of several stories to, at present, the mothers don't have time for all these things to imbibe in their children. But at the same time, after my retirement, I have started a kitchen science for the women. The women can teach science to their children in kitchen only. How is a pressure cooker working? How is the chapati goes on doing things? Everything is in science. One day, I must tell you one story. I was doing my inter-science. In those days, it was not 12th HSC. It was inter-science. I was doing my inter-science, and there was an experiment on endpoint. So I did that experiment and my teacher gave me very good because my endpoint was correct. I came home and my mother was doing the, I don't know the English word for it, vadya, श्रीखंडाच्या वड्या. मी आईला म्हटलं की मी करते ना. ती म्हणाली नाही तर तुला नाही जमायचं, त्याचा तो बरोबर मिळाला पाहिजे एंड पॉईंट. तिने एंड पॉईंटच शब्द वापरला, तिचा एंड पॉईंट बरोबर आला पाहिजे. मी म्हटलं आत्ताच मी शिकून आले आणि मला अगदी व्हेरी गुड मिळाले, मी करते. सो आय टूक ओव्हर अँड डिड दॅट अँड बिलीव्ह मी व्हेन आय से सो द एंड पॉईंट वॉज टोटली रॉंग. Instead of the vadi, it became chicky. So, this is how the mother teaches you. And similarly, my teachers were also so well. I remember Dr. Arthur Disa. Arthur Disa was my teacher in St. G.S.Medical College, and I was appearing for the Junior Shirvalkar Gold Medal. So, it was in surgery. The exam went on. Believe me, my father was the dean here at that time. But I said, no, I will appear on my own. And Dr. Lisa was my examiner. So the case was a very simple case. I had missed some of the points. So Dr. Lisa came and he said, yes, Miss Jodlekar, what are you doing? So I narrated the history, I gave clinical findings, I gave everything. And then he said, all right. And he smiled. And he immediately said, Lata, your clinical findings are correct, your history is correct, but the only thing is your diagnosis is wrong. So once that happened, first of all, I was very happy when Dr. Lisa told me history is correct and clinical findings are correct, examination is good. But then immediately a blow came saying that your diagnosis is wrong. I knew that I'm not going to get a medical. But I was happy the way Dr. Lisa communicated with me. So I have learned communication skills from my teachers. There was another teacher, Dr. Prafulla Kumar Sen, after whom the laboratory and the theatre is named. He used to come in the morning and in the corridor, tall figure, and greet. So one day I was crossing in the corridor and I said, good morning, sir. So he said, come. What is so good about the morning? I was also flabbergasted, but immediately I said, sir, because I met you, you are the first person I met you. That's why the morning is good. He said, well, I will never ask you a question again. Because this is the answer that I get. I won't ask you a question. This is how the things went on, but excellent teachers, excellent nursing staff, and really from the bottom of my heart, excellent paramedical staff and the menial staff. They were so good during our time that I never had to ask them a single question. Why is the washing not done? The sisters took care of everything. The dressers made changes what were necessary. The theatre, of course, the municipal corporation helped us quite a lot. The deans helped us quite a lot. Everybody says that I established pediatric surgery department. I didn't establish, it is those people who established. I'll again narrate a small story. Manohar Joshi was the mayor, and his nephew was admitted with an accident in our intensive care unit. There was no intensive care unit, we just had a pair of hands. We had got 23 where there were separate rooms, so we kept him in a separate room. And 24 hours what we monitored was with a stethoscope, with a pulse on the hand on the pulse, and his signs. There were no ventilators, there were nothing, no monitors. But we monitored it with whatever we had got. 42 days he was unconscious. What we did was, Manohar Joshi used to come every day morning and only used to tell me, Doctor, you are doing very well. He will come out of the coma. He was comatose. But this is what, that appreciation from Manohar Joshi was very important. The next day I could have a vigor and strength to come and work. Otherwise, we were tired. For the 43rd day, the child was conscious. And when he was conscious, we were really very happy. Manohar Joshi also was very happy. And then he went home walking to his native place. Once that happened, Manohar Joshi's wife came with a very nice gift to give me. So I told her, said, well, if you want to give a gift, you are most welcome. But not to me as a person, because I did nothing, it's the hospital which did it. So if at all you want to do anything, tell Mr. Joshi that I will come and see him. So I went to the mayor's bungalow and he welcomed. He said, what do you want? I said, we want an intensive care unit. And he said, how much will it cost? He said, 30 lakhs. Given immediately. Immediately the check was given, and then we started this intensive care unit in our pediatric surgery. Very small start. The ventilator was also costing us not even 1 lakh of rupees. But we started it. And that is how the surgery developed. Then there was a person called Batliwala who was AE in corporation. And he said, you are dealing with children, so don't have these shabby colors which the corporation has. Have attractive tiles. So he himself went, purchased the tiles and then put it. I don't know whether those tiles are now changed, but I saw the modular theatre today. Excellent. If there was word more than excellent, I would have used that. But it's absolutely fantastic. What Dr. Parelkar has done, he has done wonders to the thing which we started. And the cleanliness which he has maintained is to be appreciated. That credit he gives to the nursing staff and he also gives to the menial staff. I met all of them. They had a smile on their face. They never felt, why is this old lady come here? They were all very happy. And I was very happy to see them because one gentleman was still with me when I was working here and he still continues and he continues with full vigor. So this is how my journey has started. Then I felt that I have done enough surgery. Now I should be helping the surgeons and for that I should go to administration. So I applied for the Dean's post. First time I never got it because I was not really prepared for that administrative job. Then I realized that I must know those words properly to put into the interview people. I went to Delhi, did a course, came back. At that time in Mumbai there were no hospital administration courses, it was only in Delhi. I went to Delhi, did that course, came back, applied again and I got it. Because the words of PERT is the word shampoo only I knew. I didn't know performance evaluation review technique, that is PERT, and the CPE. So I didn't know those words and what you have to do in administration, you need to have those words. Now in technological advances, you can have it on your mobile, but in those days I had to carry big books, sit in the library. During the Association of Surgeons of India conference, in between I forgot because I must tell you, when I wanted to be a surgeon, my mother told me that I don't think you will be a good surgeon. So I said, why? She said, you cut vegetables and you don't cut vegetables properly. So if you have to be a surgeon, you have got to have good handcrafting. She knew that, she was not educated, but she knew all that. Still I said, no, I will cut vegetables down properly. Then at least you give me permission to become a surgeon. So I went to surgery and in MBBS I got the highest marks in surgery. Because in those days there was no NEET, there was no CET. Only if you get good marks in a particular subject of your choice, you will get it. So, because I had the highest marks in those days, Tata Hospital post was the much coveted post. So, I went to Tata Hospital and I told that Dean that I got a medal in surgery, so I would like to work here. He said, sorry doctor, I can't take you. He said, why? I said, I have a gold medal. He said, it doesn't matter. You can have diamonds, you can have platinum, but I will not take you. I said, why? He said, we don't have a place to stay for female surgeons. I said, it doesn't matter. I will stay in the nurses' quarters. No, it is against our discipline. So I won't give you because you are a female. I really felt so unhappy. I came back home, told my mother that this is what has happened. So my mother said, why you want to go to Tata Hospital? KM is there, you work in KM, and one day will come when you will be actually in charge of Tata Hospital. And when I became a Vice Chancellor, that day came. My mother's words were true, that I was in charge, not really in charge, I was not a director, but Tata Hospital was under us, university. So this is how one looks at, these were frustrating days, but those frustrations were taken away by my mother. My father was a man of few words, he would never talk, but he will stand like a rock behind everybody. So that's my surgical career started. Then I went to plastic surgery because I was a general surgeon. And when I was a general surgeon, patients of hernia and hydrocele never allowed me to touch them to prepare. So that created a little bit of some waves. I said, oh, this is happening. I must not continue general surgery. I must go to a place where I will be respected as a female. So I went to plastic surgery. But there, the thing was, the head of the department of plastic surgery never wanted to give a full time. They were honoraries. And he wanted not to start any full time. I left that and came back to general surgery again. And then, as luck would have it, Dr. R.K. Gandhi and Subhash Dalal came from UK, well trained in pediatric surgery, and that attracted me because, not because I was operating on the small children, but the mothers had tremendous faith. So that is what really I appreciated. I became a pediatric surgeon, established the department. Dr. R.K. Gandhi was the head of the department. And what he taught me was not only surgery, but how to get things from the administration. I used to go to Dr. Deshmukh's office, that is the Dean's office, every day morning. One day the Dean told me, Dr. Deshmukh, your round starts here or what? I am not a pediatric patient, so you don't have to come here at 8:30 in the morning. But that helped us. This is what Dr. R.K. Gandhi taught. If you want something, you have to go 10 times, not once. You have to go again and again, beg, tell them that you are good, only you can do it. So many things I learned from him. Plenty of, he was a person with a mission. Then he wrote 2 books in pediatric surgery with Dr. R.K. Gandhi and myself. And many of the things I personally, Dr. G.V. Parulkar also was my teacher here, Dr. Arthur Lisa, Dr. Samsi taught me how to be a good human being. It's not your surgery that is very important. Surgery, of course, is important. But how you communicate with the patient is very, very important. Dr. Pandya was one of my teachers. Dr. Baliga was not a permanent dean here, he was an honorary dean, but he also taught so many things. G.M. Fadke was one of the stalwarts, and one day he came to the theatre, the position was given to the patient. He came and he just palpated and said, turn the patient on the side, because it was a left-sided hydronephrosis that we had to operate and the patient was given that side up. So this is how the teacher, Dr. Baliga was sitting in the OPD. The patient came in and he said, he has got acute appendicitis, admit him immediately. So I had the courage to ask him, sir, how did you know that it's acute appendicitis? He said, you must see how the patient is walking. When he was walking, he had severe pain on the right side, and that is how I could make out that he has acute appendicitis. And his face was flushed, so he had fever. These are so many things which we now, in retrospect, I know that they teach us quite a lot. That is clinical science, which is now fast disappearing. Now we see an ultrasound, we see a CT scan, we see an X-ray, and that is how we make a diagnosis. Here, pair of hands, good eyesight, like what a surgeon is described as, he has eagle's eyes, and one quality I had, that is lady's fingers. I don't have a lion's heart, but I had lady's fingers, so I said I must become a surgeon. I became a surgeon. I wouldn't say very successful surgeon, but okay, I was alright. Then I switched to administration because I thought the people should, the surgeon should benefit if the administrator is sympathetic. Now, here Dr. Paralkar benefited because his dean sanctioned all that equipment, and modular theatre is sanctioned, and it's not only the dean, it's the commissioner, it's various corporators, and all of them understood the necessity of saying that, because in our pediatric surgery, look Mr. Surgeon, the child says, look Mr. Surgeon, exercise the gentlest care because, and correct my abnormality at the first sitting, I have to live 60 years. In those days, the longevity was 60 years. Now, of course, the longevity is increased. But this is how I took to administration. I was in Sion Hospital for 5 years. And then, I don't know, it's absolutely written in my luck that I will become a Vice Chancellor. So, while I was preparing my budget, which I never understood how to prepare the budget, but I was preparing the budget. And at that time, a telephone call came saying that your biodata is requested by the governor. So I sent my biodata. Absolutely a very sketchy biodata it was. I sent it. And then a message came that you have been selected in the first 5 and you have to come for an interview to the governor's office. So I went to the interview for the governor's office. For exactly half an hour he talked, and he said, he only uttered one sentence later on. This is a position of responsibility without authority. Do you want to take it? As a Vice Chancellor, you will have a lot of responsibility but no authority, because the authority is with the government. Do you want to take it? He said, yes, it doesn't matter. And I left. And about 3 days later, a telephone call came, Governor himself speaking, saying that I have appointed you as a Vice Chancellor. Oh my God, I was thrilled. I never imagined that it will ever happen, because the medical faculty was the smallest faculty. It was Arts, Science, Commerce, maximum faculty, Arts, Science, Commerce, engineering, etc. And at that time I was staying in Sion Hospital quarters. So immediately I picked up a phone and telephoned Dr. Deshmukh. And he started crying on the phone. So I felt so unhappy. I said, what has happened? I rushed to the house because it was nearby. I rushed to the house and he said, you know, I had tears in my eyes when I heard that, because you have fulfilled the dream of my mother. His mother and he had gone to the convocation. At that time, Dr. R.V. Sathe was the acting Vice Chancellor. R.V. Sathe is a physician. He was the acting. And his mother said, Sham, one day you will sit in this position. And look at the way Dr. Deshmukh thought that I have become a Vice Chancellor, so he has also become a Vice Chancellor. It's the way you look at things. This is the understanding between a husband and a wife, which is very, very important. And in today's days, the number of divorces that are increased is because of the no understanding between husband and wife. The husband feels if the wife is superior, he doesn't want that. So, this is a advice to the younger generation, and that is why I talk. Because you said that the younger generation will also have a look at it. If at all they listen to it, this story is extremely important. Another story in my life is also very important for the younger generation, to have a good tuning between the husband and the wife and the family. We celebrate the Ganpati festival, and our Guruji comes home for the Ganpati festival. He chants the mantras and then the murti is installed. It was 9:30 that the Guruji was expected, and at 9:25 I got a call from the hospital saying that there is a child with a distended abdomen and he needs urgent surgery. Well, all my people from my sasural had come for the puja, and Dr. Deshmukh had put on his usual clothes and he was to do the puja in 5 minutes. My face was, I don't know what was an expression on my face, but Dr. Deshmukh read my face and he said, Lata, don't worry. Your Ganpati is in the hospital. Go, finish the case and then come back. I will look after it. This is how the tuning between the husband and the wife, and more credit to Dr. Deshmukh than me. I was in two minds whether I should stay here and tell my junior to continue. No. And that boy was an imperforate illness. I had to do a colostomy. And he went through the second stage. He got very well. Now the boy has a hotel in Mumbai. And the boy's father telephoned me every year. Year after year he used to telephone me. Now the boy has established as a hotel person. And he said, Dr. Deshmukh, you must come to inaugurate. I said, I have nothing to do with the hotel at all. He said, no, it is because of you that this is the gratitude which people give to the medical profession. So this gratitude, the younger people must understand why you are taking medicine, why not any other profession. It's the gratitude which is very, very important. So, in short, I had an excellent life. I am now 80 years old, but I still am able to walk, I am still able to function, I am still able to talk. God has been very grateful to me. आणि म्हणून मराठीमध्ये असं म्हणतात, येणाऱ्याला पाणी द्यावे, मुखात वाणी गोड होई, जाणाऱ्याला परत फिरून येण्याविषयी ओढावे, ऐसा सुंदर माणुसकीचा झरा वाहावा मनामध्ये. या सुंदरशा G.S. मेडिकल कॉलेजचा आणि KEMचा उत्कर्ष व्हावा जगामध्ये, उत्कर्ष व्हावा जगामध्ये.
Madam, I have something to ask.
खूप बदल
May I ask that?
पुष्कळ बदले.
Madam, I remember you inquiring about congenital anomalies, how to reduce them in
Yes.
and also you have been doing a lot of work about Garbha Sanskar. So both these things are like preventive aspects.
Yes.
So I would like you to elaborate on how you got interested in this and what are your thoughts?
Yes. I thought I looked at the watch and I said I have talked a lot, so I didn't touch upon the later part. While doing pediatric surgery for about 40 years, I used to correct the abnormalities. And I could see the pangs in the face of the mothers and the fathers and everybody, and the suffering of the child. Then I thought, after I retired, I decided that there are much better surgeons than me, so I will not continue to do surgery, but I will do something to prevent these abnormalities, which I have been able to correct them. But every time I corrected the abnormality, there was about 5% or 6% defect still remaining. I operated on a cleft lip and a cleft palate. The lip looked good, but there was a little bit of defect still. Same story of spina bifida and same story of diaphragmatic hernia and tracheoesophageal fistula and so on and so forth. So I said, can I do something to prevent these abnormalities? Prevention is better than cure. The preventive medicine, she is here, preventive medicine. She will always say that preventive medicine is the best. But to prevent these defects, it's a long course. It's not the 9 months and 9 days journey. It is even before that. Before the mother becomes pregnant, she has something in her body that creates problems. The main thing is nutrition, and which people do not understand. So I decided to start. It's not Garbha Samskar. Garbha Samskar is a false name. We don't do any samskars to the baby. Baby doesn't understand. But he actually comes to know from the voice of the father and from the voice of the mother. After 7th month, when they try and hear and they understand, at that time, at present I am working on the emotional bonding of the father and the fetus. So how is it done? It's done via music. we tell the father to sit in front, and after 7th month the fetus starts hearing very well. 8th month excellent, and 9th month like you and me he hears. So we put the music whose beats increase, and once the beats increase, the fetus then takes more amniotic fluid and his weight also increases. And this thing we learnt when a nurse showed me why the weight increases of very tiny neonates, that is 1 kilogram and 1.5 kilogram babies come here. And that time I was in Sion Hospital, Dr. Armida Fernandez was in charge. She started the milk bank, and that has been very, very helpful. So at that time, the weight of the child being so low, she also started kangaroo care there. And she said that let's put music in one group, and in another group, the usual thing. So we saw that the group where this music which increased the beats was put in, that group increased the weight 13 to 14 days earlier than the first group where there was no music. So we all felt Tansen was singing and the lights came. Is it like that? Then the nurse observed and she said, look doctor, when the music beats increase, the sucking reflex of these children also increase. And that is why they put on more weight earlier than the first one. Then we transferred it to pregnancy and we had the similar results. So it's the weight of the child, because ultimately the Barker's hypothesis is known to everybody. Low birth weight and the length of the child is also small. The ponderal index is also very important. So those people who had born with low birth weight have a tendency to develop diabetes early, tendency to develop hypertension early. If we develop hypertension at the age of 50 or 60, they develop it at the age of 20, 25. Of course, stress plays an important role. But for stress relief also, music therapy is very important. So this is what we have started now. The weight increase is important. The communication with the baby is extremely important, and the voice of the father is very important. So these three things now we are working on it. The project is going on. It will take a long time by the time I publish the results, because just now I have finished only 1500 cases. I must have 15,000 cases. Lot of people are doing it. We have also started working in with the neonatologists and everybody. But it will take time till we prove. One thing is true, that all this does not go a waste. We have been able to convince mothers to have a normal delivery by giving them all the details, explaining to them the sonography, explaining to them why they should eat, how they should eat, when they should not do exercise. And otherwise the mother-in-law always tells, during our time, we used to do everything, sweeping, cleaning the floor, why are you not doing it? It's not that. If the placenta is low, then you should not do those exercises. This is what is very important. So all these things can be done not by the obstetrician, because they don't have time. They have plenty of cases waiting. I have a lot of time. I spend about an hour and a half with the patient, the mother. So what is very important is the communication with the mother-in-law. That is very important. Mother-in-law is the one which creates a lot of problems sometimes. So I'm not blaming them. I'm also a mother-in-law. So I might have created problems for my daughter-in-law. But the understanding between the mother-in-law and the daughter-in-law is so sad.
Madam, you have translated Perils of Democracy.
Yes.
And you have written like Marathi.
Yes, I have written 16 books.
Please tell me.
Only 2 books in English, rest of the books are in Marathi. because I feel the translation of that book was done with a understanding that what the governor feels about democracy, what is democracy, should go to our people in Marathi. So I translated it to Marathi and then went on feeling that if it is the book which really speaking gives all the information, so I kept on writing about information. My recent book I have brought here, yes, short stories, and in that book there is a story of in KM also. So that's why I felt I must give that book here. Whom shall I give it?
We keep in our human library.
Yes.
Humanity library.
It's in Marathi.
This is okay.
It's okay.
Another compilation of the physicians' stories and
A compilation of physician stories is another book, but that is also in Marathi. That I have not brought. This is the recent book.
but this is what we have started keeping under human, and this Dr.Manu will have a chair on medical humanity. We keep this books.
Yes. So,
Right now it just gives us 5 books. This is what I break.
I have a couple of questions.
yes, okay.
Madam, I would like you to give advice to the young surgeons, general surgeons, why they should take up pediatric surgery and why more and more people should take up pediatric surgery.
Yes. Child is the father of man, Samantha. It's absolutely not true, but the child grows, and when he grows into a mature person, whether it's a man or a woman. If pediatric surgeon exercises his best skill at the time of surgery, during when he is operating, whether it's a neonate or an infant or a child, then the child will live with a good quality of life till the 70 years, 80 years, what is the span of life. The pediatric surgery people don't take up, people are not wanting to take up, because though there is a challenging field, it doesn't give you a lot of money. And many of the children with defects, what happens is that the mother and the father don't want that child. So the child remains in the hospital. We had, in our career, we had 10 children, 10 children who were left by the mothers, and we took care of them. Everywhere the money is involved. Number 2, most of the people who are in corporation or in the government, their children don't suffer from these abnormalities. So they don't understand the seriousness, and that is why in medical colleges the pediatric surgical departments are not started. Once the departments are started, then people would take up, because ultimately there are now several medical colleges. I was conducting an interview 3 days back. They have decided now that all the district hospitals will be converted into medical colleges. District hospitals converted into medical colleges, but most of them don't realize that it is the pediatric surgical wing which is very, very important. Pediatrics and pediatric surgery. Maternity is looked after. They don't require intensive cares. What they require is a good health and a good surgeon at the time. So the youngsters should now think that it's not the money that matters. It is the gratitude of the child and the father and the mother that matters. I think I mentioned it, part of it in my speech. But if you are only after money, don't come in medicine. Once you come in medicine, take up a subject of your liking. And I personally feel, instead of just doing general surgery, which is vast, it has now broken up into several things. Urology is separate, cardiac surgery is separate, everything is separated out. To a general surgeon, hernia and hydrocele is only remaining. Practically nothing is there. So pediatric surgery is one thing which is actually like a general surgery. So please take up pediatric surgery. See to it that the children who benefit from your surgery will become good citizens of tomorrow.
Yes. Thank you. And message for young pediatric surgeons and a little old pediatric surgeons like
You are not old. You are young at heart. You are young at heart. You are not old.
Thank you.
Yes.
Message for us.
Spread this message of pediatric surgery, importance of pediatric surgery. The book which Dr. R.K. Gandhi had written is Shunyat Srushti. He has given the title Shunyat Srushti. He has talked of pangs of parturition. He has talked of the phases of development of pediatric surgery. He is a visionary, good thinker. So, the message is that continue to do your good work and work in such hospitals like KEM, Sion, Nair, Cooper, or municipal corporation, or even in JJ, the government hospitals. Never look at those 5-star hospitals, because 5-star hospitals are good, they look clean, but many of the 5-star hospitals, as I have the knowledge, are manned by homeopathic doctors. And the nursing staff is also not really of that importance. So that is why. And the clinician comes only for an hour or so. There is no full-time person. And if you are in full-time, stick to full-time. It's not 9 to 4. It is continuous. It's a 24 hours job. And see to it that you do that 24 hours job so well that people will be grateful.
Madam, besides this medical education and medical committees, you have been advising government and the society about education system and values in education system.
Yes.
So, please tell us about your thoughts.
Well, we all talk of values, we all talk of culture, we all talk of knowledge. But truly speaking, these values should be imbibed by the person and they should be given to the person by your own way of behaving. In Marathi, there is a small saying, खरी अध्यात्म वृत्ती कृतीने दिसावी, मुखे वाच्यता त्याची कधीही नसावी, तुझ्या दर्शने बंधुना धीर यावा, असा पंथ अध्यात्माचा असावा. अध्यात्म म्हणजे काय? अध्यात्म म्हणजे नुसतं माझं चांगलं वागणं नाही, मी दुसऱ्यांना काय देते, अतिशय महत्त्वाचं आहे. तेव्हा व्हॅल्यूज वगैरे हा सगळ्यात ठीक आहे. एथिक्स, बायोएथिक्स इज ए सब्जेक्ट विच हॅज बीन स्टार्टेड बाय MBHS. So in the interview I asked them, what is bioethics? None of the candidates could answer. They were all MD, MS. None of them could answer. That means the bioethics, because probably there are not many marks given to bioethics. I do not know the recent one. So this is how the culture has to be given, it has to be developed by the father, mother, by the friends, and of course by teachers. Teachers are extremely important. If a teacher is practicing outside and not giving enough time, then he cannot say that you have to be there. I remember Bharti Kulkarni and so many of my colleagues who used to sit with an ambu bag, at that time no ventilator, hours together, used to continue working there. But that culture is not seen now. Of course, your people, when I saw them, I could see that the culture continues. Yes. Bijal, Rahul, and the NS
We are
cities.
blessed with
Good people.
Madam, you have got a good feel of the society at large. So I would like to ask you, do you feel that whatever medical or healthcare system that we have today and the needs of the society Is there a connect, or you feel that there are gaps? How do you look at it?
There are a lot of gaps, as I can see. As I told you, one day I was talking to some politicians, I won't name anybody. It was in Thana and Mokhada and Vada. They were starting an intensive care unit. So I told them, really speaking, according to me, they don't require intensive care because many of these children are malnourished and they are very near death. What we should do is to improve their nutrition right from birth, and the mother and the when there was a strike of those Anganwadi workers, I met the Chief Minister and I told him, said, this is the work which Barker's hypothesis shows why Anganwadi workers are very important. Because I said, you increase their pay, they need a little more pay, so you increase their pay, but it never happens. So there is a little disconnect between what I am saying, not me, many people, what they are saying and what is actually done. Do we need more intensive care units? The time should come when we don't need intensive care units. We should first look at the nutrition. That is very important. But the chikki which is supposed to be given to the children never goes to their mouth. And many such things can be taught, but this is no criticism. This is what is. You asked me a question. What do you feel? Is there a connect or a disconnect? I feel there is a disconnect.
One more thing, madam, ki nowadays, for the reasons which have been actually mentioned by you, many doctors are not very keen that their own children become doctors. Whereas in your case, it's the fourth generation that is.
Yes, fourth generation. Thanks to my children and their children. Thinking. Yes. But there is a lot of difference between my father, my grandfather, my children and her children. And his children, of course.
Yeah, but they are all connected to KM. I mean,
They are at present, yes. Dr. Deshmukh was in Nair.
sir was in Sion also, but
Was in
your
Sion.
father.
Yes, my father was in Sion, then he came to KM. And my grandfather was a homeopath. He practiced, actually I became a doctor because I saw that he was practicing in one of the villages. At that time it was a village, Gahagar and Hindi. And there was a sort of a small place outside the room. He used to give medicines, those small little pills. Yes. But what he used to do first is that whenever a patient came from long distances, what he did was offer them a little rice and water first. First eat and then I will examine you. So he will examine them later. And I used to ask him because his wife was not liking this. She had to cook so much of rice. So she was very unhappy. So I said, you are troubling her and your grandmother. I said, no, this will go a long way. It is very important that the person has come from a long distance. He must have something in his tummy so that he doesn't develop acidity. What a thought process at that time. He said the stomach empties in 2.5 hours. And he has taken so much time to come here. So first he should eat something. And this is what I can afford. I cannot afford a lavish lunch or dinner. I can afford rice with ghee and a little salt. So, and then when they became better, they used to come and touch his feet. So I said, will it happen to me any time that somebody will touch my feet? If I become a doctor like him, then it will happen. So I decided to become a doctor. That was it. Every holiday, there was a long holiday in the school, 1.5 months. Every holiday I used to go with my grandmother to his place. And sit there and observe him. So, these are small little things which make you feel. Supposing my grandfather was a millionaire, I would have taken to medicine. But I said, all right, we have plenty of money. I don't have to do anything. But I came from a very ordinary family. When I got married also, we were staying in a chowk, Keshavji Naikchar. And I really liked the atmosphere there because everybody knew everybody. When I got married and we were climbing the stairs, the whole thing was full of, the corridor was full of people. They were wanting to know, how does this lady look like? So that was the atmosphere. Nowadays nobody bothers. Things have changed for better perhaps, because they see it on WhatsApp. No. Before the marriage also they see the photographs. Alright.
Well, thank you so much. It was really
I spent a lot of time here, but every minute was enjoyable. Nostalgia. Yeah. Manubhai Kothari was our teacher in anatomy, and I was not very good student, but I remember one thing. He said, Lata, I must tell you, if you have to know anatomy, you must observe people properly. That observation is very important. And then he sat down and had a tailor's position and said, this is the action of sartorius. You will never forget how I am sitting just now. If a teacher is like that, all your life you remember. You don't have to read and take it by heart. This is what teaching is for. How a teacher should be. By his own example. And in that anatomy lecture hall, it was the same lecture hall, where on the platform he sat tailors. How a tailor sits, like this. So I can't do it now, but he did it at that time. How is the tailor's muscle? Palmar spaces. He would teach palmar spaces so well, why an incision should be on the side, why a palmar space is very important. Extremely well. Another very important thing which he explained to us was peritoneal reflections. We never understood peritoneal reflections as well when he did it with a handkerchief and the peritoneum all around. And he said the best way to teach peritoneal reflections is take a odni and make small little things reflections. When I operated on my first case of malrotation, I remembered malrotation at that time. Because it is the various small little things which have the adhesions to be broken, how the duodenum should be released from the adhesions. Great man.
In nature, there is no error of terror. For congenital malformations,
Yes.
when you were discussing, in nature there is no error of terror.
Right. Wonderful teacher.
No terror.
I had excellent teachers. Thank you so much.